Hello, thanks so much for checking out this link to get your free tour of the AORN eGuidelines Plus website. So I'll start off by showing you the guidelines. If you click on guidelines, you'll see that there are two views for any guideline that you look at. So let's just look at electrosurgical safety. So you'll see that there's a book view. This is going to give you what you would actually see in the book. So this is going to give you the really detailed referenced information and points for each of the guidelines. And then also the quick view will take you over to a more kind of easier to understand, easier to kind of find what you're looking for. This will take you to the highlighted bulleted points of the guideline. So this is really great if you're just searching for something really fast. If you're looking to update a policy and procedure, you might want to stick with the book view portion of it. Next, I'll click to the at-a-glance tools. We are constantly adding to these at-a-glance tools, starting with anesthesia, handover tools, medication, positioning, procedures, room setup, and skin prep. So these are really do deep dives into, let's just look at positioning as an example. So at a glance, we're going to look at the reverse Trendelenburg position. This takes you into, you'll see the contents on the left, the preoperative assessment, the physiologic effects, positioning best practices, and special considerations, and of course, references. So let's look at positioning best practice. This will give you the best practices for positioning the patient in this position. Also, special considerations, and like I said, references as well. This is a great thing to reference, especially if it's been a while since you've positioned this way. This is a great tool to use for your in-services on positioning and super great for those new staff members in the OR. The other one I'll show you in this area is procedures at a glance. So this really does a deep dive into these procedures. Let's look at ortho. We'll scroll down, we'll do an IM nail. This does a deep dive into first what landed the patient in your OR, so the indications for the procedure. You'll see it covers positioning, preparing for the procedure, workflow, variations, complications, post-op recovery course, and special considerations. So this is fantastic if you have a nurse or yourself have not been in a certain case for a while or a certain procedure, you can look it up. Another thing that's amazing is that when it takes you through the basic workflow for the procedure, it will also give you illustrated versions of the instruments that they're referencing. I like it because it has the alternate name. So people will call it a pin, a K-wire, cannulated pin, Steinman pin, lots of different names for it. So we cover those as well. Super helpful for learning, initial learning, and then for brushing up on skills. Next, we'll look at tools. The tools section, this is a treasure trove for nurse educators. It's a fantastic grouping of the tools that we have. You can either browse by tool type. You'll see that we have in-service PowerPoints, gap analysis tools, quite a few competency verification tools. You can also browse by guidelines. So if you need to brush up your skills or your team skills on laser safety, maybe for an in-service, you can click on laser safety and see all of the tools that AORN has to offer. So there are audit tools, case studies, competency verification tools, lots of great stuff in here, like I said, for educators. Next, FAQs. These are taken from our nursing consult line. So when individuals call in with certain questions, if we see that question popping up quite a bit, we'll pull it into our FAQs here. You'll see it's divided out by topic. And then additionally, we'll have a book section. So the NAON, the ARIN books, those books are available as an add-on to your subscription. We also have the perioperative care of the COVID-19 patient. This one's very important in this day and age. Curriculum for the RNFA, a really comprehensive grouping of guidelines and tools for sterile processing so they can come right to this. Tissue management, and then of course, infection prevention policies and procedures are housed here as well. And then something brand new, we've had the Joint Commission standards have been out there for a while. We call it the AORN Accreditation Assistant. This is a crosswalk between the tools that AORN has to help meet Joint Commission compliance. So these are divided out into the 5 sections, of course, ambulatory critical access, hospital, basic hospital, office-based surgery, and sterile processing. And something brand new, it just came out within the past month, are the triple AHC standards. So this is the accreditation assistant to help those facilities who are accredited by the triple AHC to help them on their journey to make sure that they're doing everything right and have all the tools they need to reach that accreditation. So this was a super brief tour of AORN eGuidelines Plus. I hope you'll take some time to reach out to us at periopsolutions@aorn.org for a free trial of the site. We'll send you a link that can be used for a month, actually. And we can also answer any other questions you have. Thanks so much again for stopping, and have a great day.